Hello, welcome to VMC. I'm Dr. M. Join us as we unveil the information you need to know about tuberculosis and how it is a zoonotic disease. Stay tuned for essential information that you and your family can use to keep yourself and pets as safe as is possible. Join me, you'll learn something today. I decided to make this video because John Green has been putting out a lot of social media about tuberculosis recently.
Tuberculosis?
Not sure exactly how he got started on the topic. If you know, please comment it down below and let me know. But I ended up seeing through the YouTube videos when he started posting a bit about it, and then some of his social media posts have also come across my feed.
Okay, so 1.6 million people will die of tuberculosis this year, more than will die of malaria and HIV combined, which is especially infuriating because tuberculosis is curable.
First, I remember John Green just sharing information about what TB is as far as how it pertains to humans. Then I heard about John Green and Nerdfighteria contacting Johnson & Johnson about their patent on the antibiotic bedaquiline. Bedaquiline has had a patent for some time now, and this patent was coming to the end of its lifespan, and Johnson & Johnson was trying to extend that patent because then of course nobody else can make generic bedaquiline, and if generic bedaquiline is produced, that will end up bringing down the price of this antibiotic, which would mean more people can end up having treatment. So with pressure from John Green, other influencers, Nerdfighteria, everyday people, Johnson & Johnson ended up agreeing that they would allow for a generic bedaquiline to be manufactured and sold to poor and middle income countries. This is a huge win because it means that more people will end up being able to afford treatment. So after that, John Green turned his attention to the price of the tests for testing humans who are suspected to have TB, not only to figure out if they have TB, but also to figure out which drugs their TB might or might not be resistant to. This is very important information to have because if you start the people on the incorrect treatment protocol, it's not effective, it continues to drive resistance, it brings up the cost, it adds to the disability that the people experience, the suffering they experience, and of course, a lot of them will end up dying without the appropriate treatment. So this meant that John Green and Nerdfighteria started focusing on the company Danaher, who produces machines as well as tests that are read by these machines in order to sort out if people have a drug-resistant tuberculosis or if they have TB at all. Again, John Green has had some success here. He has managed to get Danaher to agree that they will decrease the price of their regular TB test, not the one that tests for drug-resistant TB, so there's still more work to be done, but this is a big deal. And Danaher also agreed that they would have a third party come in to see and assess the cost of producing these tests, and Danaher agreed that they would not make any profit off of these tests for poorer countries to purchase them. Again, this is a huge deal. This means that more people will be able to be diagnosed and maybe even properly diagnosed, and that will mean more successful treatment, less death and disability. This is a major win. First, we need to discuss exactly what is TB anyway. Tuberculosis is caused by a mycobacterium, so a type of bacteria, and the specific one is called Mycobacterium tuberculosis. M. tuberculosis causes disease in humans, other primates, and in guinea pigs. Then there is a related bacteria, Mycobacterium bovis, and this bacteria causes disease in cattle, rabbits, cats, and in a bunch of wildlife. Interestingly, swine, so pigs, and canines, dogs, can be affected by both strains. This bacteria is spread through aerosols, so people breathing, talking, coughing, sneezing, singing. So the bacteria will get into the air, another person or animal will breathe it in, and then that person will become infected with TB. Now, the somewhat good news, I guess, is that TB is less contagious than COVID or measles, so it tends to most often take a more prolonged amount of contact in order to get yourself infected. That's not always the case, but as a generality, that is true. Of course, we also have to remember that anybody who has any sort of a compromised immune system, so people who have had COVID, people who have HIV, people who are undergoing chemo, people who are malnourished or incredibly stressed, all of those situations can suppress the immune system and will increase your chances of contracting TB if you are exposed to it. As I mentioned before, this is a zoonotic disease. That means it can spread from animals to people. One of the most common ways that this occurs is through breathing the same air as an infected animal. However, it can also occur by ingestion of contaminated food or water. One of the most common ways that people end up getting TB from cows is actually ingesting unpasteurized milk. Now, animals can spread it from one to the other through aerosols as well. They can also spread it through ingestion of contaminated water or food. So if they are sharing a water trough or eating off of the same area of grain or hay or pasture, then they can contract TB that way from another animal that currently has it. Next, let's talk about the different stages of tuberculosis and what symptoms are often noted depending on which stage of the disease an individual is in. So a primary TB infection occurs immediately after the animal or person has been infected. At this stage, the immune system is trying to clear the disease, so you may be asymptomatic or you may have mild symptoms like a bit of a cough, a low fever, that sort of a thing. What's unique about M. tuberculosis and bovis is that the cell wall is exceptionally thick, and this makes it quite hard for the body's immune system and white blood cells to get through and completely dismantle the bacteria and clear the infection from the infected individual. As a result, what commonly happens is the individual moves into the second stage of a TB infection, which is called latent TB. An individual with latent TB has had their immune system wall off the tuberculosis. These are called tubercles. So the immune system has walled off the TB in tubercles, and as long as the immune system remains strong and fully functional, then the TB should remain in that latent stage. However, as we mentioned before, things that stress the immune system can result in the TB getting out of these walled off sections, and that can move the patient into the third stage of a TB infection called active TB. Active TB occurs in about 10% of patients, and generally this happens after months to years of having a latent infection, which can make contact tracing very challenging, and it can also make clearing herds of cows and so on quite challenging to do because you have to increase your monitoring for such an extended period of time to make sure that no other animals contract it. This ends up killing around 1.6 million people every year, and it's mostly people who are unable to afford proper diagnosis and or treatment. Common symptoms include things like coughing up blood, fevers, lack of appetite, losing weight, night sweats, tiredness, overall not feeling well, what in veterinary medicine we call ADR or ain't doing right. It's also very important that we note that tuberculosis can spread from just beyond the respiratory tract. When it spreads to other parts of the body, this is called extrapulmonary TB. It can affect the kidneys, bone marrow, the larynx or the voice box, the heart, joints, lymph nodes. TB can spread anywhere it wants to. This extrapulmonary TB will cause a variety of symptoms depending on which parts of the body it's affecting. So if it has, say, affected the kidneys, then you would see symptoms of kidney failure and so on. In veterinary medicine, TB is considered a reportable disease, and so there are government organized and even WHO organized methods for addressing and eliminating spread of TB. Depending on exactly where you're located, These protocols can vary a little bit. It usually involves things like regular TB testing. For cattle, this generally means doing a TB skin test. What happens is an injection of tuberculin is put into the neck or sometimes the tail fold of the cow, and then 72 hours later those cattle are looked at again, because if they have TB, they will have a delayed hypersensitivity to the injection of the tuberculin, and you will see a test result on their neck. So the spots that occur on the neck are measured, and there are parameters for what equals a positive test versus a negative test. Now for humans, the testing is a little bit different. We need to find out not only if the human has TB, but what specific strain it is and how drug resistant it is. And then based on those results, a treatment plan is formulated and implemented with the goal of being able to cure that person's TB. It generally is curable for people that have correct access to the healthcare that they need. So what should you be doing to decrease the risks of both animals and people contracting and spreading TB? Well, one of the first things that should be done is to wear respirators. This is very important because it will reduce your risks of contracting anything that can decrease the function of your immune system. So not only will it reduce the spread of TB through the air, but it will also reduce the spread of viruses like COVID that also damage the immune system and increase your risks for tuberculosis. So you should wear a respirator to prevent yourself from getting TB and other viruses. It's also important that we remember people from areas with higher TB prevalences, places like India, are more at risk for having TB, and people that are in close proximity to each other for extended periods of time are also at a higher risk of contracting TB. All of these are called high-risk congregate settings. So when you are in those sorts of settings, wearing respirators to reduce your risk of illness is important. Third, if dealing with any symptoms, it's important to seek medical care as promptly as is possible. Early detection of disease means better success with treatment. It also means less risk of long-term disability for the individual. Now, of course, for cattle, because they are called early detection, means less risk of spreading TB to other cattle or to wildlife or to people. So early detection is very important, both with reducing harm from TB and reducing the spread of TB. 4, do not drink unpasteurized milk. There are many reasons why you shouldn't drink unpasteurized milk, but the risk of TB is one of them. Make sure that you are getting pasteurized milk products. Lastly, there is a BCG vaccine that is being used in countries with higher risk for vaccination of children. In North America at this time, it's not a recommended vaccine, as it can interfere with testing for TB in the future in some cases, and the chances of people in North America contracting TB aren't high enough at this point to make it worth using this vaccine here. However, in countries that do have higher risk of TB, that vaccine is being used quite regularly. It should also be noted in the prevention side of things that governments do have veterinarians working in food production for a number of different reasons, and there is testing of carcasses of animals as well as products to look for diseases like tuberculosis. Veterinarians that work in these situations are looking for TB in respiratory tracts, and if they find it, then that will lead to tracing where that came from and the removal of that animal and its products from the food supply system. But this is one of the jobs of veterinarians, is to help protect the food supply, and we very much operate under the concept of One Health, where the health of animals and people is very closely interlinked, and as veterinarians, it's our job to protect the welfare and well-being of all species. I will absolutely be putting additional reading for you in the doobly-doo if you are interested. I would highly encourage you to join John Green and Nerdfighteria in working to make a difference in how we approach TB, and to urge companies to remember to prioritize people over profits in order to reduce the suffering of people in these countries that have a higher risk of TB. I do put up a video most Fridays, so if you have a topic that you're interested in, please comment it down below, and I look forward to seeing you in the next one. I hope that your weekend is fantastic, and we'll see you soon. Bye! It just tickled my funny bone. Tuberculosis. What was that show now? Urkel.